Hello, everyone. Dr. Stillman here, and today we are going to talk about what I consider to be some absurd health advice that people are handing out via the internet, vilifying one of my favorite food groups, nuts and seeds. I have come to the conclusion that vilifying entire food groups, single nutrients, various other biochemical structures, categories, you name it, is truly the modern day identity politics of nutrition. It is so simplistic and it leaves out so much detail that can make or break a case and your success as a patient, my success as a clinician. Okay. Because remember, I actually see patients. So some of the things I see on the internet being hawked as advice just blows my mind that anyone has the gall to say it. Because when you really start to take care of patients in large numbers, doing very intensive dietary histories, you develop a profound respect for just how nuanced and detailed you have to be in order to really understand and draw firm conclusions about what we should eat. And even then, you'll start to see patient after patient after patient after patient after patient who breaks rules you thought were set in stone and proves you wrong. So let's talk about what I'm talking about. This is a post from Carnivore Aurelius, whose stuff I generally speaking adore, but this one was too far. Let's talk about why. So Carnivore Aurelius says the only raw nuts you should be eating are bison testicles. I strenuously disagree. I think nuts are an incredible food source. We may debate about whether or not they should be raw, sprouted, cooked. If they're cooked, should they be roasted? Should they be steamed? Should they be stewed? Should they be soaked and then cooked? I tailor all that to patients. You can apply for consultation at stillmanmd.com. I get asked all the time if raw nuts like almonds are a health food. The answer is no, they are not. And there is no reason to be eating them along with grains, beans, nuts, and seeds are loaded with endogenous pesticides for protection like lectins, blah, blah, blah. Nuts are high in omega-6s. They irritate the gut. They're loaded with digestive enzyme inhibitors, trigger inflammation and allergies. All of this is kind of true. Are they high in omega-6s? Yes, we're going to talk about why the omega-6 fallacy is a fallacy. They irritate the gut. Well, whose gut? And which part of the gut? And which nuts and seeds? Are we talking about conventionally grown almonds sprayed, loaded with some kind of pesticide? I don't even know what. Grown with synthetic fertilizers, stored for long periods of time in humid conditions, leading to something like mold growth? I mean, or are we talking about organic, fresh, perfectly raised, perfectly harvested, perfectly processed walnuts? This is an important distinction. And all these details just get lost in these things like irritate the gut. Loaded with digestive enzyme inhibitors that block nutrient absorption. You can break these things down. They do not inhibit your absorption to the point of totally derailing digestion. If they did, people who ate nuts and seeds would be dying, and they're not. We're going to cover that data in a minute. Trigger allergies and inflammation. Okay. Allergies to what? Inflammation of what variety? What are we talking about here? All of this is totally unquantified, totally unqualified, just random hashtag words, slogans, things to make you buy the stuff that people are selling and fearmonger you into not eating things that I know are good for you, based not on one or two studies, but extensive clinical experience and really surveying the literature. In this study, he points out, he's got this highlight. This included 2 to 3 tablespoons of tomato paste per day. And just to give you guys the background, this is a study where a patient who ate certain variety of foods that are high in oxalates, many of which are nuts, had acute damage to his kidneys from oxalates. I could find you a paper on this with almost anything. I mean, almost anything. Every food can be consumed to excess. I've seen the most amazing things eaten by patients. I have to tell you that the guy who takes the cake is a patient of mine who he ate large amounts of lamb brains in order to meet his DHA and EPA levels. Yes, that's how extreme some of my patients are. This guy ate a very high oxalate diet. What happened? They found out he had kidney damage, tubular oxalosis, acute kidney injury, mild glomerular changes consistent with diabetic and hypertensive nephropathy. This is important, and you'd really only know this if you'd taken care of patients with diabetic and hypertensive nephropathy. But there are many, many patients with these illnesses who may have borderline issues with oxalates, but they do not get kidney damage from oxalates. Likewise, when people develop these changes, or if they develop an oxalate nephropathy, they are far advanced in their metabolic dysfunction. So telling a 30-year-old who's healthy, that you shouldn't eat these foods because a 50-year-old in poor health who's been destroying their metabolism for decades had on this one occasion a bad outcome because they followed an extreme diet is very extreme. It is not fair to apply this so cavalierly or carelessly to so many different people. Nuts and seeds are an amazing food. I cannot tell you how nutritious and life-saving they can be. The bottom line with this, you could justify anything you want to do with the literature. And this is why I really don't like getting I don't get health information. I don't go to people like Carnivore Aurelius for actual medical information. It's cute slogans. It's great memes. Sometimes it's good products. Things like beef liver could be good for you, but they could also ruin you. And I've seen that over and over again. Let's talk a little bit more about what he's talking about. Oxalate nephropathy. This is an actual case report of somebody who developed oxalate nephropathy due to juicing. Okay. You really have to pay attention to the details of these things. It may seem boring to listen to me rant about this stuff. You may not particularly want to get into the details, but as I like to say, the devil really is in the details. If you don't have the patience for the details, if you don't have the patience to check somebody's math and really go through the process of understanding exactly what the paper said and how it was put together and who the patient was and whether or not it applies to you, then good luck. But I think you're going to fall for a lot of really bad marketing narratives. You're going to buy a lot of really grossly marked up product. And you're going to wind up working with practitioners who really don't have a broad scope and depth of knowledge in the literature, let alone in clinical practice. This is a patient showed up with oxalate-induced acute renal failure associated with an oxalate-rich fruit and vegetable juice diet. This is why empirically, when I start taking a case, I don't just jump to juicing. And I really take issue with people like the medical medium who do that, because I've had people come to me who were fans of his, who had really remarkable laboratory abnormalities that I can only presume were the result of excessive juicing. I know it's good for you. I know it's loaded with nutrients. I get it. But there is such a thing as overnutrition. I've seen it. I've documented it. I've gotten people off of it, and I've watched them get better. So this is a case, and they also reviewed the clinical presentation of 65 patients seen at the Mayo Clinic over almost 30 years with renal failure and biopsy-proven renal calcium oxalate crystals. Cause of renal oxalosis was identified for all patients, single cause for 36 patients, 2 causes for 29 patients. This is a very small proportion of people. The number of people who get calcium oxalate-induced renal failure or kidney injury is vanishingly small. I say this having seen, I cannot tell you how many people with chronic kidney disease or acute renal failure or injury, whichever you want to call it. Can you make an argument to me that I might put some stock in that long-term higher intake of oxalates is associated with increased rates of disease and kidney injury? Yeah, sure. But let me ask you something. If you monitor these patients' oxalate markers and then get them on a low or reasonably low oxalate diet, do you really need to worry about that? What I'll tell you, having taken care of people with oxalate issues, is that they have other metabolic abnormalities that come out in their labs. And when you fix those, you can see a lot of general clinical improvement. And then they can go back to eating oxalates. What an amazing concept. Clinicians should be aware that an oxalate-rich diet may potentially precipitate acute kidney failure, renal failure in patients with chronic kidney disease. That's a really important part to this paper. You need to understand that the things you can and cannot do depend largely upon your underlying health. This is one reason why I think blundering through life with no concept of where your labs are is bizarre. It's not so much bizarre. That's perhaps being unkind and critical, overly critical. You've been led to believe that there are only very boring, very superficial labs that can be done for you. I'm here to tell you there's more comprehensive, more in-depth labs that we can do to understand what makes you you, and then draw some meaningful conclusions about how you may want to change your diet, your lifestyle, or look into changing your environment in order to fix the medical problems that you have or prevent medical issues that you're concerned about developing, okay? And the point of this paper is simply that if you juice a ton in the setting of kidneys that don't work that well and a metabolism that you've perhaps been wrecking for years with crazy diets or terrible environmental, toxins or stressors or whatever, then you probably shouldn't jump onto a juicing diet. And that's why I like to keep this at 4 ounces until I know more about the patient. Then we can boost it up to 8. Depends on the juice, depends on the patient. I tailor all that based upon laboratory data. Oxalate nephropathy, a systematic review. How common is this problem? It's not common, which is why I think really talking about oxalate-induced kidney injury is big. I mean, it's really making a mountain out of a molehill. All right. So how many people are we talking about and who are we talking about? 57 case reports, 10 case series, totaling 108 patients. The median age or mean age was 56.4. 59% were men, 15 were kidney transplant recipients. You're worried about oxalates ruining your kidneys, and 50% of the people are kidney transplant recipients, 59% are men. If you're a 30-year-old mother of 3 with normal kidney function, there's a really good chance you don't need to worry about oxalates. Not saying you don't, because you might, but honestly, avoiding nuts and seeds because you're just worried about oxalates? No. Fat malabsorption was the most commonly attributed cause of oxalate nephropathy, followed by excessive dietary oxalate consumption. This right there tells you something really important. Fat malabsorption, it's an inability to absorb fat. We can test for that with a stool test. We can treat that, and we should really be asking better questions like, why does the patient have fat malabsorption? Rather than how do we reduce the amount of oxalates in the diet? You need to do that until you fix the fat malabsorption problem, but it's a fixable problem. And it's always a harbinger of worse things, so it's worth fixing. And it's always the result of many chronic lifestyle choices and environmental stressors or toxins or whatever derailing your metabolism. Baseline serum creatinine was 1.3 milligrams per deciliter, which is high. I rarely see anything even approaching this, even in my most fit muscular patients. Patients had a bunch of different urinalysis problems, blah, blah, blah. I could go on. This is rare. This is a really rare clinical condition. Like I said before, I've never seen this in years and years of practice. And it's the kind of thing that doctors prep for board exams to remember. It just doesn't happen that often. Is it terrible when it happens? Yeah, it's devastating. Some of these people need dialysis. Some of them remain dialysis dependent, which means their kidneys stop working and don't come back online. And that's tragic. I'm not trying to minimize that. But avoiding nuts and seeds because of this and only eating things like testicles, it's just not necessary. How do I assess whether or not something is something that my patients need to avoid? I like to look at the all-cause mortality data. This data is fraught with problems because it's epidemiological, and that means it's subject to many, many confounding factors, which we'll talk about. For example, people who eat nuts and seeds tend to be more health conscious. They're a more expensive food. But let's also bear in mind, and we're going to talk more about this at the end, that the quality of the ingredient makes all the difference to its health effect, okay? When someone says, I eat a lot of nuts and seeds, and what they really mean is that they eat some kind of industrially farmed, canned, processed, packaged, roasted, loaded with food additives, flavor enhancers, MSG, whatever, nut and seed mix, that's a very different thing than somebody who's eating something that's fresh, freshly shucked, hulled, organically farmed. This is a very different product, let alone a product like a nut or a seed oil. All these studies are fraught with these problems. So when I am looking at this, I want to say, okay, do the people who eat nuts and seeds die more often? Okay. And indeed, we do not see this. Higher nut intake is associated with reduced risk of cardiovascular disease, total cancer, and all-cause mortality, and mortality from respiratory diseases, diabetes, and infections. So you're going to tell me not to eat nuts and seeds when this is what the all-cause mortality data says? I care about all-cause mortality. I care about all-cause mortality because if something's bad for you, it should increase all-cause mortality. And if something's good for you, it should reduce all-cause mortality. There's some important caveats to that. The number one caveat I would make is that when there's a lot of money at stake, let's just say that sometimes truth is the first victim. So when I see, let's say, a clinical trial reporting a reduction in all-cause mortality, I know the pharmaceutical industry has done things like sweep suicides under the rugs in order to make their product look better. That's a matter of the historical record. You don't like it, go check it out. Or better yet, do something about it. But the point is, the nut and seed industry, particularly for fresh nuts and seeds, is not going to game this data. Or at least I don't think they are. And it is so robust. Paper after paper. We found that higher nut consumption is associated with lower risk of all-cause mortality, blah, 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 blah. Nut consumption and risk of type 2 diabetes, again, inversely associated with many, many, many diseases. And I will tell you that when I see something like this in the literature, I don't just take it for granted. I want to go back into my practice and say, okay, does this pan out with what I'm seeing clinically? Because you'll get fooled by the papers, but your patients, so long as you're nice to them and make it really clear that you need them to be radically honest with you, even if it means criticizing you, I'm totally okay with that. I got that from a patient this week. I didn't take it personally because it's not personal. If they're comfortable with you, they'll tell you what worked and what didn't work. And I have been amazed in my clinical practice by, I hope you're sitting down for this, the failure of fish oils to get people better. I want to unpack that for a minute. So fish oils get lionized in the medical literature as this amazing thing that reduces inflammation and it reduces blood clotting and saves us from heart attacks and strokes and all these other things. The literature on fish oil is actually very mixed, which is to say, when I say mixed, I mean, you've got some studies over here that say, wow, fish oil did a great job. And then you got these other studies over here that say, wow, fish oil didn't cause or it really improve anybody. Having spoken to many other integrative docs, we've all at some point in our career experimented with prescribing fish oil. I have to tell you, I have been singularly unimpressed with the clinical results of that. And that led me to ask questions like, why don't I see clinical results with fish oil? Why don't I put somebody on cod liver oil or a high quality sardine or anchovy-based fish oil? It's loaded with EPA and DHA. Why don't I do that and then have them come back and say, Dr. Stillman, I have less pain, I'm feeling better, I have better energy, I have better, cognition and whatever. I don't see that happening. I can't tell you how many patients that's happened with. It really surprised me in my first couple of years doing intensive nutritional counseling. And the other thing I found, especially as I started to take care of people who are very health conscious and follow Instagram accounts and get their advice from them, was the number of people who are on fish oil. And I kept having people who were very health and wellness conscious coming to me with fish oil levels that were way higher than I would recommend taking, and they were only achieving them through fish oil supplementation. So I didn't see high doses of this resolving issues. In fact, some of the sickest patients with the most intransigent, difficult problems I've taken care of in the last couple of years, since I really started doing intensive nutritional counseling and medicine, have had high levels of fish oil. That really caught my attention. I will never forget and not only that, but they had high levels of fish oil and low levels of omega-6s. And this really made me pause and stop and wonder, why do I see sick people coming to me desperate for help who have low omega-6 levels when omega-6 levels are apparently really bad for you? And then I got into the literature on this because my friend Brad Weeks turned me onto a really interesting book called The PEO Solution, which has some very controversial information in it. I don't agree with everything that Peskin and Rowan, those are the two authors, say in this book, but there's some really important food for thought in it. And one thing that they have convinced me of is that the omega-6s are not bad the way that everyone is calling them. They can be corrupted, adulterated, polluted. They can be made bad for you by our industrial process. And this is why you will not find a refined seed oil in my house. You will not catch me recommending them to a patient. And I used to, because I didn't know any better, and I own that. But you get better and you learn more as you get older. And at 33, let's just say I have a few more things to learn. This whole meme that omega-6s are bad, nuts are bad, lectins are bad, phytates are the devil, you can't eat any of these things, you should only eat meat. It just falls apart in clinical practice when you start putting people on plant foods and then they start to magically resolve medical problems that nobody else has been able to figure out and they've been struggling with for like 30 years. I mean, I wish I was making this up, but I'm not. Dietary intake and biomarkers of linoleic acid. So if omega-6s are bad for you, then increasing levels of them and intake of them should make you dead, shouldn't they? right? It stands to reason. You don't actually find that. Higher linoleic acid intake assessed by dietary surveys or biomarkers was associated with a modestly lower risk of mortality from all causes, cardiovascular disease, and cancer. These data support the potential long-term benefits of PUFA intake in lowering the risk of cardiovascular disease and premature death. How about that? Now, this is not licensed for you to go out and gorge on fast food, which is loaded with vegetable oils that are high in linoleic acid, because the linoleic acid that you get out of the fry well at your local fast food restaurant is not the same as the linoleic acid that you're getting from, say, organic, freshly, shucked almonds or walnuts or cashews or pecans or pine nuts or whatever. Why is this? Again, serum linoleic and very long chain and omega-3 PUFAs reflecting vegetable oil and fish intake inversely associated with all-cause mortality. Let's go back to the fish oil for a moment. So I think it's really interesting that fish oil took off. I prefer fish. When you look at fish, they have a lot of micronutrients that are sometimes certain fish and shellfish much higher than in their land animal counterparts. And that makes fish a really interesting potential source of nutrition in the diet. Particularly the sardines and the anchovies pack a major punch when it comes to some trace elements like magnesium, potassium, calcium, which we see associated in deficiency with cardiovascular disease. Coronary artery calcification is a story for another day. It's not a simple topic. We'll get there. But the point is this: eating nuts and seeds, eating fish, and eating particularly the nuts and seeds that are high in omega-3 PUFAs is my recipe for success. You will find every single one of those foods in my pantry, and you will find an abundance of fish in my freezer, but you will not find any fish oil in my house. Why might this be? What's a unifying hypothesis that can explain that despite omega-6s driving things like arachidonic acid translation or transformation into prostaglandins that can then contribute to a certain amount of inflammation, why do omega-6s reduce all-cause mortality? Okay. It's this paper nicely sums it up. It's expanded upon by Dr. Peskin in his book, PEO Solution, Medical Hypotheses, Volume 70, 2008. What you got to understand about the cell membrane, this is well set down in the medical literature, is that the composition of the fatty acids in the cell membrane govern what comes across the membrane. Wastes out, nutrients in. You make that membrane the wrong composition, bad things happen. Okay. And one of the things that happens is lack of proper oxygenation of the cell. This abstract is loaded with meaning. I'm going to read the whole thing and then I'm going to unpack it for you. With the exception of melanoma and non-Hodgkin's lymphoma, the incidence of cancer has peaked in the last several years, but rates and mortality are still high. Moreover, despite 50 years of intensive cancer research, increasingly focused on genetic causes, no single unifying causes for cancer has been established. Although it is well known that tumors are hypoxic and that there is a correlation between the level of hypoxia and prognosis, with the exception of Warburg's studies, that's Otto Warburg, Germany, 1930s, I think, 40s, maybe. Nobel Prize, no big deal. Little work has been done to investigate the relationship between hypoxia and cancer. Over 70 years ago, Warburg showed that cells could always be made cancerous by subjecting them to periods of hypoxia. Moreover, he demonstrated that once cells had converted to a cancerous state, reversion could not occur. Modern biochemistry acknowledges that there is a switch from oxidative phosphorylation to glycolysis in tumors that might be concurrent with hypoxia, but does not address the cancer causation. It is our hypothesis that long-term hypoxia of cells in the body, measured in years, is the primary trigger for cancer. We believe that the hypoxia, which has to meet Warburg's findings of a critical 35% reduction in intracellular oxygen levels to initiate cancer, is linked to the incorporation of adulterated, non-oxygenating, or inappropriate polyunsaturated fatty acids into the phospholipids of cell and mitochondrial membranes. Such incorporation causes changes in cell membrane properties that impair oxygen transmission into the cell. Trans fats, partially oxidized PUFAs, and inappropriate omega-3, omega-6 ratios are all potential sources of unsaturated fatty acids that can disrupt the normal membrane structure. In this paper, we explore this hypothesis by examining the evidence and additionally propose an appropriate PUFA dosage for humans by analyzing requirements and taking into account current PUFA consumption patterns. What does all that mean? Why did I bother to read the whole thing to you, boring and pedantic though it might seem? Number one, isn't it interesting that the incidence of cancer, according to them, has peaked in the last several years, but rates of mortality are still high? I actually take issue with this. I'm not sure that they're right about it. This was written in 2008, was it not? And I will point out that it's Peskin's the guy who wrote this book that I just showed you all. We're going to be doing this in a book club. If you don't know about the book club, go to my Substack. I'm always posting about when the book club is going to be. It's usually on a Tuesday night. We go over a book, and I live stream it to Facebook and YouTube. There's a members only Q&A after that for members of the Substack. Okay, so that's why it's important to subscribe to that. All right, despite lots of years of cancer research, we still don't know why we get cancer. How about that? It'd be a real shame if we found out the answer, because then we would not, have to spend fortunes of money on, cancer treatments. And then, the pharmaceutical industry executives who make a fortune off of that wouldn't be able to buy homes in the Hamptons and the Martha's Vineyards and the Cape Cods of the world. But, although it is well known that tumors are hypoxic and that there is a correlation between the level of hypoxia and prognosis, with the exception of Warburg studies, little has been done to investigate the relationship between hypoxia and cancer. What that means is that no one's interested in understanding cellular hypoxia because it doesn't make anybody really rich. But Warburg's work on this remains unchallenged and frankly definitive in the field. And so the question of what causes cancer ultimately arguably comes back to Warburg's ideas about what caused hypoxia in the cell. So the name of the game when it comes to maintaining arguably all cellular metabolic health, and this is backed up by the work on ozone, the work on hyperbaric oxygen therapy, things like that. It comes down to how do you get oxygen into the cell, okay? When oxygen tensions in the cell drop, bad things happen. What's standing in the way of oxygen getting into the cell? Cell membranes. What are cell membranes made of? Fats. How about that? So think about how many membranes lie between oxygen in your lung, the alveoli, and the mitochondria in your cells that burn it to make energy. There's the membrane of the alveolar cell, which technically has two membranes. Then there's your blood, right? And in the blood, you need to get it into the red blood cell, which has a cell membrane. Okay, now it gets to the tissue through the blood. Now it offloads from the red blood cell. It has to go back through the red blood cell membrane. Then it has to go out of the endothelial cell, which is the lining of the capillary or the cell, the blood vessel. Then beyond that, it has to get out of the endothelium. Then it has to get into the interstitial space. And then it has to get into the cell. Then it has to get into the mitochondria itself. So there's many different membranes, depending on how you slice it, different levels of anatomy. And all of these membranes are made up of fats. So if you have the wrong fatty acid composition, you're slowing down and changing the rate of oxygen transfer many, many, many times in this process, which means small alterations to the amount of fatty acids in your diet and their balance can have profound effects on your physiology. And this is why I never shoot from the hip and assume that you guys have a certain fatty acid level, because you people have surprised me over and 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 over again with the wacky membrane compositions that you will develop, because you all eat different things. And as I tell my patients, you're all special, just like a snowflake. You all fall and you all melt in your own special way. So I don't assume, I test. That makes me sleep well at night. Over 70 years ago, Warburg showed that cells could always be made cancerous by subjecting them to periods of hypoxia. That means that if you deprive the cells of oxygen for long enough periods of time without subjecting them to enough to kill them, they will turn cancerous. There's a switch here from oxidative phosphorylation to glycolysis in tumors that might be concurrent with hypoxia. People have been really running around this issue for a long time. And I will tell you right now, it's about more than just fatty acid membrane composition. It's about B vitamin levels and minerals and amino acids and carbohydrate metabolism, all these other factors that we can look at if we do the right nutritional analyses and if we take a proper history and understand how the patient's eating, how much, when, why, how they feel, so on and so forth. Warburg found that you need a critical 35% reduction in intracellular oxygen levels. It's nice to have an actual benchmark through which this occurs. And what Peskin and his colleagues are saying is that it is linked to incorporation of adulterated, non-oxygenating, or inappropriate polyunsaturated fatty acids into the phospholipids of cell and mitochondrial membranes. When you start talking to people about what happens when they change the fatty acid composition of their diet, let alone start introducing phospholipid supplements into their supplement regimen, you start to hear some pretty profound, amazing, and frankly unbelievable stories of clinical improvement. The composition of your cellular membranes is truly in the blind spot of a huge proportion of people. Now, the funny thing about this is because all of you are different, coming from different places, different times, different spaces, different genes, and different diets, some of you have too much in the way of PUFAs, and some of you don't have enough. Some of you have really sick, disgusting, terrible PUFAs because you've been frequenting places that shall remain nameless, but that go by the catch-all of fast food joints. Some of you have wonderful PUFA quality because you're, obsessive compulsive about your diet. But any of you can err in one direction or another to create a problem with your membrane composition. And it is shocking to see how people resolve chronic medical problems when you fix these things. And it all comes down to actually quantifying how much do you eat of different sources, and then how do those get incorporated into your membranes, which you really fundamentally only substantiate and demonstrably prove with a lab test, not by assuming that it's going to be such and such because of this and that intake. I've seen people with the same dietary intakes have different lab values. It's not a fluke. It's a combination of genes, environment, various other factors. Incorporation of these sick fats causes changes in membrane properties that impair oxygen transmission into the cell. So the healthier your cell membranes in terms of the fatty acid composition and the more oxygenating omega-6s that they have. Let's be really clear about that. Low omega-6 levels in the cell membrane in many different studies have been shown to reduce oxygen delivery to the cell and create issues with lipid peroxidation, hypoxia, and all kinds of other metabolic cascades. And this is why I have no problem whatsoever with PUFAs from fresh nuts and seeds, okay? That doesn't mean saturated fat is bad. It doesn't mean the carnivore diet is wrong. It doesn't mean that nuts and seeds are never bad. They sometimes are, but this whole thing about oxalates and PUFAs and whatever, and never eat this and never eat that, it is the identity politics of nutrition. It is for people who don't actually take care of patients full time and who haven't seen the healing power of plant foods at work in their clinical practice. And I will happily debate and converse with anyone on this topic who wants to challenge me on that. So as always, thank you for watching. Don't forget to like, comment, share, subscribe. Make sure you're subscribed to the Substack, the Telegram. As always, consultations, stillmanmd.com. Apply for consultation in the upper right-hand corner. Thank you everyone for watching. Have a great day. If this video has been helpful to you, make sure that you check out my link tree below to find out how you can keep in touch with me best. And if you would like to become a patient at my practice, please apply to work with me at stillmanmd.com. Thank you again for watching. Have a great day.